Hi everybody, Dr. Ahles here. In this short video, we're going to talk about two of the main disorders that we see with leukocytes, with white blood cells. The first disorder we're going to talk about is leukemia. Leukemia is a type of cancer that is primarily manifested with issues with the white blood cells. So when we talk about leukemia, what happens is instead of making normal types of white blood cells, we're making several white blood cells that are not functional. There are two kinds, big picture kinds of leukemia that we can see. The first kind are myeloid leukemias. So myeloid leukemias develop from myeloid stem cells. Here's a quick reminder that my myeloid stem cells turn into my granulocytes, that's neutrophils, basophils, eosinophils, or they turn into monocytes. If any of these kinds of cells are made incorrectly and there's too many of them, we would call that a myeloid leukemia. So unsurprisingly, when we talk about a lymphocytic leukemia, we're talking about an issue with the lymphoid stem cells. So remember that lymphoid stem cells turn into B lymphocytes or T lymphocytes. The first thing to know about leukemia is we have these different kinds depending on which kind of stem cell we started from, myeloid or lymphoid. The next thing we need to know about leukemias is whether they are acute or chronic. When we talk about a leukemia that is acute, what that means is it developed quickly and it spreads very quickly. Acute leukemias, where it suddenly appears very quickly, we primarily see those in children. This is because an acute leukemia develops because of an issue with the stem cells themselves. So we go from some event, whether we're born with a genetic mutation or something happens to our DNA, at the stem cell line, we've mutated it, meaning that now we're going to make a ton of non-functional white blood cells. That's an acute leukemia, which is seen, again, primarily in children. Chronic leukemias are more slowly advancing, and chronic leukemias are primarily seen in adults. The thing with a chronic leukemia is that we don't have an issue at the stem cell level. We have an issue at one of my other levels of development. So maybe we're on that granulocyte track and we develop a leukemia. My other types of immune cells may still be fine, but this particular group of cells are not. So chronic leukemias develop more slowly. We see those more in the adult population. Acute leukemias develop very quickly, and these are primarily seen in children. Ultimately, what can make leukemia so deadly is we end up with anemia. Remember that anemia is when we don't have enough red blood cells, or the red blood cells aren't functional. We can also have issues with bleeding. We're getting ready to talk about platelets, which help to stop bleeding. The reason we see low numbers of red blood cells and excessive bleeding is because when we have these cancerous white blood cells, these cancerous leukocytes, they end up going into the body's functional red bone marrow, where I make red blood cells and where I make platelets, and they end up taking over. We no longer have healthy cells to make any of our blood cells. So the first disorder of leukocytes, leukemia, cancer of the white blood cells. The other disorder of leukocytes that I want to mention is infectious mononucleosis. It's more likely that you've heard of this just called mono. When we talk about mono, we're talking about an infection of the body's B cells. So remember, B cells are lymphocytes. They can turn into plasma cells or memory B cells. Fun fact about mono, it actually got its name because they used to think that mononucleosis infected monocytes, but they realized with more studying that that was actually not the case. But the name stuck, mononucleosis, an infection of B cells. How you would diagnose a mononucleosis infection is by looking at a blood smear Someone with mononucleosis will have extra lymphocytes, extra B cells, extra T cells. But many of those lymphocytes are going to be abnormal. They won't function correctly, and as you can see in my picture here, they're not shaped correctly either. So the body's trying to respond to this infection, but the cells that it's creating are not helpful. They're not going to be able to fight the infection. Mononucleosis is very easily spread in body fluids. The primary fluid that we think about it being spread through is saliva, which is why mononucleosis is sometimes nicknamed the kissing disease. So spreading this virus primarily happening through that saliva, other body fluids as well. Mononucleosis, very common in adolescents and young adults, most likely related to its nickname. The time when kissing occurs more regularly can lead to this infection, mononucleosis. When we talk about mononucleosis, there are several symptoms that can be used to diagnose it. So probably the first symptoms that you would recognize would be being extra tired, having a fever, a sore throat. As the disorder progresses, lymph nodes, especially in the neck, will get swollen as the body is making all of these extra white blood cells to fight the infection. And one of the other more dangerous symptoms that comes with mononucleosis is what's called splenomegaly. In other words, an enlarged spleen. The spleen is the primary location where we store platelets for blood clotting. If the spleen gets really enlarged and we somehow rupture it, that can be deadly for your bloodstream. So, mononucleosis, an infection of the lymphocytes, specifically the B cells, the body makes all of these B cells that don't function correctly, and as it does these things, we see these different symptoms that appear. Mononucleosis, spread through saliva. Remember that leukemia is based on a genetic mutation, either in a myeloid stem cell or a lymphoid stem cell.